Welcome for another episode of G and Tonic, or as we call it, the main gun in Teixeira, a new webcast that we have. So today we have the pleasure have one of my classmates that to me she was one of the best students I've ever met in medical school. Her name is Dr. Dion Metzger. She knows it's
I
true.
love it. I love that
So
intro.
super smart, super smart. We went to medical school together, Morehouse, and then subsequently I went for my residency. She went to her residency in psychiatry at Emory, and then she also had I think it was a master. You did something in California, correct?
Oh no, I did an internship with Stanford.
Yes,
Yes.
internship at Stanford.
Yeah.
I love her motto. She has a great motto.
Mm-hmm.
Is better mind, better life. And I think that is so awesome.
Mm-hmm.
I mean, I think we can always use that. She's a health and wellness expert. She's been featured at ABC, NBC, HLM, New York Times, Open Winfrey Network. Also, she is a bestseller writer, right? And the book that she wrote is The Modern Trophy Wife, How to Achieve Your Life Goals While Thriving at Home. Listen, you should also have one for men, okay?
I'm
Because
thinking about it.
sometimes we cannot even survive. Listen, a successful man cannot survive without a very strong woman, a very successful woman behind him. There is
That's so
no
true.
way we cannot do it. There's no way. I
Mhm.
promise you that. That is for sure. But listen, welcome as always. Today I thought it was a great idea for us to talk about obesity and more of like, bariatric surgery, mental healthness and depression afterwards.
Mhm.
We hear a lot of patients having issues. Not a lot, but there are some patients that come to the office post-op. Like usually it happens with about 30 days. They start having some difficulties, some buyer's remorse,
Mhm.
more for the mental component, but you're super happy with the weight loss. But you're trying to figure out how to deal with their emotions, anxieties, etc. Right? So it is a very fine-tuned, fine balance that we have to keep those patients on, right?
Absolutely.
So, well, we love for us to just go in and start talking about that. I
Sure.
think this is a great episode.
Sure. Yeah. So when you approached me about the topic, I actually loved it because I actually have quite a few patients that I see privately post surgery. And it's just something that they're all connected, right? Body image, obesity, depression, just overall wellness, they're all very much connected. So I think it's hard to talk about one without talking about the other. Um, you know, One thing that I probably see in my practice is that sometimes when people go for the surgery, they think that that's going to be the fix all. So after they have the weight loss and they have the new body image, there might have been some untreated depression or untreated anxiety from even prior to the surgery. And then when they have the surgery and they have the weight loss and they're so happy with the results, they're like, wait, I'm still not feeling great mentally. And what I do is really just talk to them when I realize that, this was something that you were dealing with even prior to the procedure or prior to even considering the procedure. So I think, sometimes people go in with the thought that it's going to be a fix-all. And I think we can't talk about one without talking about the other. So that one is probably one that I see a lot.
Right. And I feel like one thing that we talk about, I tell the patients as well, that I would like them to log into the support groups even before they have the surgery to see what other patients went through. A lot of people can tend to make them feel that, like you stated, as fix all, or it's going to be la vie en rose afterwards. But it's important to talk to those patients that are 8 years out, 10 years out, see what their struggles are. Just like in life, pre-surgery and post-surgery, nothing is going to change. There's going to be the ups, there's going to be the downs. All you can do is really hope that the ups are better and do maximize what you can do to prevent those lows as well and manage them properly.
I totally agree. Go ahead. Sorry, Andre.
Mm-hmm.
No, I totally agree. I think a lot of times people just they don't go in thinking that there's other things that need to be worked on as well. And I think there's just,
Mm-hmm.
I love the fact that you mentioned support groups because I do have a few patients who do go to groups of people who've gone through the same procedures. And I think there's just such a benefit in being able to talk to somebody who's been through it all, because there's one thing we can talk about it even as their physicians, but I think somebody who's had the experience can give something that we can't. And I think being able to
Mm-hmm.
connect with somebody who's been through it, I find it really helpful. And if you can't do it physically, like going and sitting in groups. I mean, there's so many options, especially since COVID now, for virtual groups where, if it's a Facebook group or somebody who's kind of gone through the surgery, I just think they have a wealth of information that they can provide in helping you through the process.
One question that sorry, go ahead. Yeah. Yeah. One question that I get asked about often actually is that pre-op is patients ask me, once I have the surgery, I hear often that after the surgery in the first month or so, patients go through a lot of psychological and emotional changes. What is your expertise on that, and what do you have to educate the public on that?
Absolutely, because any kind of transition that we have can be a potential stressor. So if your body image and your body is transforming, that's also a transition. So people are getting used to seeing something new in the mirror. And although maybe something you're completely delighted with and excited, it's still something very new. So we have to recognize that changes come as stressors. And I think a lot of people don't kind of think about that ahead of time because they're so excited about it. But you have to recognize that it is a transition, just like, if you're moving to a new home, all transitions can come as potential stressors. And you can see the results that, mentally people might just have a little bit more anxiety. They might notice that their sleep patterns are getting a little disrupted. They're feeling a little bit sense of sadness. Some people, even they go through a little bit of grief about what they used to look like, because they've been used to seeing that person in the mirror the whole time. And now this is a brand new person. So, even though it was something that you prefer to look like now, there's still a little bit of grief associated with letting go of your previous image.
Mm-hmm.
That's interesting, right? I mean, the grief period, right? And we see that. We see patients that they have surgery 6 months ago. You're looking great. But when you come to see you in your appointment, you notice there's something just not right with the patient, the way they're behaving, the way they're looking at it. And you ask them, and most of the times, right, those patients that are going through this issue is they're not feeling comfortable, right, with that new image yet, right? They don't feel comfortable with the attention they're getting it, right? People starting to notice them. They're not just a plus one in a party.
Got it.
People start
noticing
different attention they want to go. Exactly, right? I actually had a patient of mine that I operated on her, did a bypass on her 7 years ago. She came back a year later, 18 months actually, started sabotaging herself because she did not like the attention. So she gained all her weight. She came back about 2 years ago for me to do a revision on her, right? I said, I'll do it, but you're going to have to participate on counseling. Right. So she was on counseling with our own psychologist for 2 years before she felt comfortable with her new imaging, and then I did the revision, right? Because if I have done the revision before, she would have failed all over again, right? So I think it's very, very important the connection between a psychologist, psychiatrist, whoever's taking care of the patient, right? To continue that post-op, right? This is your other tool, right? The same thing we talk about, me and Gunnar talk about a bariatric operation just being a tool to put you on the right track. A mental health wellness, right, person like yourself, it is one of the most important tools on the entire journey, in my mind. The same thing with nutrition, right? Because if you think about it, we are just a person that are able to build a tool and give it to you, but you have to learn how to deal with all issues.
Exactly, you have to have the tools yourself.
Right, and
so how do you how do you give the tools to them? How do you kind of help them out develop their own
what
tools?
I like to do, and there's some patients that I've been able to see pre-op before they make the decision, and before we even get to post-op, I'd like to ask the question about their motivation for the procedure. All right. Same thing. We want to make sure that people are not going into this thinking that this is a fix-all, that they're not doing this to try to. You'll be surprised. I'm sure you wouldn't be surprised. You've probably seen all of this, but some people go into this procedure thinking it's going to repair a marriage that's failing. You see a lot of different kind of underlying things that are kind of pushing people to want to do these procedures. So one thing I like to really ask about is it just really that you want a better body image, or is there something that you think is going to happen as a result? So that's one of the things I like to do, but definitely post-op, just really talking about it. I really like to ask very open-ended questions like, what is it like? I mean, you're now, because like it's a whole transition. And I always remind people before they have it, it's just, you're now going to different stores to buy clothes. You now can wear different things that you couldn't before. You now are getting this attention that you never necessarily gotten from people who may have been your friends for years, but now all of a sudden you might be getting a little bit different attention than you've gotten when you were, at a different weight. And, unfortunately, that's just how the world is. But, I really, sometimes it can be a little bit too much for people. So I definitely understand that patient that was like, yeah, I don't know if I can handle this, because the attention comes all at once. And we're in a society that people ask about weight so casually. So if somebody has had the surgery, it's not something necessarily that people want to broadcast, but you will find people who know you will ask publicly, oh, did you get the surgery? What did you do? And just bringing more attention on them. And it's, for people who already have some underlying anxiety or depression symptoms, I can see that spotlight can be more of a stressor than something that they want.
Right. And this is something that I actually see often, what you mentioned before, that we as a society can ask about this very casually. It's totally acceptable. One patient came to me about a month afterwards, losing the appropriate amount of weight, even a little bit, probably more ahead of schedule, losing about 30% of her excess weight in a month and a half after surgery. And she just told me, I'm not happy with the weight loss. I told her, I'm looking at your numbers. They look even better than on track, I would say, probably on the higher side. And once I explained to her everything, she said, you know what, doctor, I'm actually was very happy with the weight loss. It's just that people keep asking me and they keep telling me, oh, shouldn't I have lost weight more? They obviously don't know that this is not going to happen in a month and a half. They're not, they didn't do the research. They come in and they throw that at them and they just tell them, oh, did you have the surgery for? How much weight are you going to lose? Oh, you only lost, 45 pounds or so within a month and a half. Well, are you happy with that? What she kind of thought about that was, she said, actually, I was very satisfied with the way I'm losing. From now on, I'm just going to tell them, this is my private business.
Yeah, and
so
that's
one
boundaries.
Question to you, right, and that's boundaries, and that's very healthy, I think, especially in this type of.
As a matter of fact, I tell people not to really
procedure.
disclose it if they don't have to, the amount of weight
Right.
loss, just because, you're going to get feedback and not all of it's necessarily going to be positive. And really, nobody can decide your ideal body weight except you. So I think, if you have, and sometimes it's people who are really close, it's spouses, parents, just kind of putting their 2 cents in. But I try to tell people that you only have to disclose as much as you want. People will be nosy, but you can say it's okay. I don't want to share that.
Right, absolutely. So one thing that I wanted to ask you, patients often, when I ask them what topics they want to talk about, this topic actually popped up often, like we said beforehand, and how to cope with all of those changes and stressors afterwards. And, we kind of touched about it beforehand. I know it's not a one size fits all, but do you recommend in general that they start laying out their coping mechanisms prior to the surgery, or play it by ear, or see a therapist and see how they do? What is your 2 cents on that?
Well, you know me, I'll send a dog to therapy. Everybody can get therapy. So I'm always a fan of therapy. So
I can tell you my dog needs
yes
therapy, that's for sure.
She's gonna be. You know what?
I will send everybody to therapy. So definitely a yes, because I think you have to get ready for a transition, right? So we have to think about it as grieving a previous body. So definitely, if we can do therapy beforehand and start talking about the coping skills and really just getting ready for the transition, like something upcoming that's going to be a whole new chapter, I think that can only be helpful.
Perfect.
So Dee, quick question. So, what I've noticed too, I've been doing this for almost 11 years now, right? I'm Bariatrics. So something clicked, right? During COVID, right? Really clicked that I feel patients now are way more comfortable in looking for
yes, absolutely,
help from psychiatrists, right? Before COVID, I would see patients say, guys, listen,
it brought it to the spotlight.
And I'll refer you. I ask you, I said, she can come and talk to you right now, because we have one in our office, right? So I said, she can come and talk to you right now. It's like, no, doctor, I'm okay. I can deal with it. Now they ask,
It's a beautiful
It's
thing.
crazy. I mean,
It's a
yes,
beautiful
which
thing.
I'm so happy.
Yeah, I mean,
Yes.
pandemics are terrible, but I must say, if we're going to look at positives that come out of this, is that people recognizing that their mental health is a priority. There was something about people being isolated, kind of out of their work routine, that made them kind of come face to face with what they were dealing with mentally. And it was a really wonderful thing. I mean, even with me in my practice, like, I mean, my numbers tripled because more people were home, and then plus also having more of a telehealth option for I can see people across the state. So not only has it brought more people to treatment, but now there's more treatment options because I never did telehealth prior to the pandemic, but now I can see people all through Georgia. So I think it's been a double win on that side where people are talking about it. And even in the media, I think, you see more news stories about people talking about depression and anxiety that COVID-19 came with. And I don't think it created it. I think it just kind of brought it to the surface for most people.
100%. I think people used to use that
Mm-hmm.
workaholic.
Hmm.
I'm a workaholic, right? Meaning they're just escaping from their reality, right? They'll go from work, go do something, they go home
Right.
and sleep and start all over again, right? And also, I think I agree with you 100%. I think one of the things that telehealth did was approach mental health issues with
Hmm.
their practitioners, right? I think he has
Yes.
shortened that bridge, right, between the
Yeah.
patient
Yeah.
and the physician, right? And to me, especially for the mental health component, to me, you like you said, you can pick up a phone,
Mm-hmm.
do a consult, you see it, talk to them right away. You don't have to wait until
Nope.
you have an appointment
Mm-hmm.
Right.
available, et cetera, right? So to me, that's
No,
added a
and
huge
I think
benefit. Go ahead, Dan.
especially
So
with mental health, because there's sometimes this kind of, I don't know how to describe it. Maybe you're something that for somebody like myself, it might sound a little bit intimidating to go to a therapist office or so. For them, they don't know what to expect if they've not done that before. To do it virtually might bring some coziness to them. They're doing it from their own house in their safe place, so to speak, and that makes it so much easier in many many ways. And I think also the pandemic has also highlighted this also for not just for patients but for physicians as well. I mean, there was physician burnout, for those listening that don't know, was a very real thing with especially with the pandemic beforehand, and it's now more highlighted more so than ever. And I think it's only this kind of whole concept of mind body connection is fairly recent in Western world. Might have been kind of known in the Eastern societies beforehand, but now it's fairly recent how this affects our bodies, our eating habits, kind of relevant to this topic as well, and the way you think, or so on and so forth. And I think I agree with you completely. This virtual thing might have a lot of disadvantages, but I think the advantages for now far outweigh the
Yeah, I mean, because
disadvantages.
even when I came back in the office this year, and I've had a lot of patients who are like, you know what, I'm cool with virtual. Let's just keep doing it that way.
Hmm.
But one thing I love that you brought up physician burnout is that I have seen more physicians because of telehealth. Because I do think that I have quite a lot of physicians as patients, but I do think there's a little bit more of a stigma for them to come into the office and sit in the waiting room of
Hmm.
the psychiatrist as compared to us just being to directly connect, just the two of us. So I do think me even having that, and I didn't even think about that prior to the pandemic, but just for privacy reasons, I have had definitely more of a physician patient population that I didn't have prior to the pandemic. And that's just because they love the one-on-one privacy of telehealth.
Right. I mean, we are right. We're
so
lucky enough
it's
to
fun. It's funny.
have a great job, Andre and I. But the only reason that I might get burnt out is just from sharing the office with him. If I'm honest with
No,
you.
but it's too much. So, but on a serious note, the burnout. I mean, I can tell you this.
Oh
You
man,
know,
it's so
it
real.
is real though. Burnout, physician burnout. I can tell you that
Mm-hmm.
by the end of 20, like in December of 20,
Mm-hmm.
I was pretty tired. I mean, I was
Mm-hmm.
like on fumes, right? Um, it was a very difficult year, right? I think 20 for us. I mean, in terms of not just because of COVID itself, right? Because there's so many people. COVID
Mm-hmm.
also shine a lot of light on obesity, right? And the risks of the obesity and COVID and so forth. So we were like mean, we have people flying in from everywhere to have surgery with us. We're operating Monday through Monday. So it was by the end of December. So I stopped operating. I think the 28th of December.
Mm-hmm.
I was like, I'm done. I can't do this anymore. So I took a week off. I took a week
Mm-hmm.
off. I probably needed more, but the week off I
Yeah.
took, I just completely disconnected. Right. I mean, to the point that I just didn't want to see anyone, talk
Mm-hmm.
to anyone. Just kind of really want to relax. And January usually is a very slow month for
Right.
bariatric
Because they're
surgeons
the deductible.
because of insurance. So they kind of play in advance. But I totally see my colleagues getting super burnout, especially the guys who are in ICU and
Mm.
ER. Dear Lord,
Oh
so
yeah. Can you imagine
so
working in the
I
ICU right now,
Absolutely. Right.
100%.
or
So
during
I
COVID at
think
the height?
right. So I think well, like you said, the same thing for patients. Practitioners also need to listen to their own mental health, right? And I'll be very honest with you, right? Before my Ghana is our junior partner. I mean, he's senior partner because he's been practicing for so long. But for the practice, he's the youngest practice guy that came in, right? But before him came in, I was just work, 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 and then I'll come home, meetings, presentations, write
Mhm.
books, research. It
Yeah,
just
because I know you present
yeah.
too.
So, but when he came in, he showed me a different way to say, hey man, you need to slow down. Right. He actually
Mhm.
talked to my wife and said, hey,
Thank you for doing
yeah.
that.
He talked to
Right.
my wife and said, you need to make him slow down. And
Because
Right. Oh
I know
yeah.
I remember you from med school. You'll keep
I
going.
know. But I have
Hmm.
slowed down actually. And I
Right.
learned
And
to say no.
that is an important skill to learn. And I say I'm lucky enough to work with a friend. Now, joking aside, and I think it was one day that you and I and him were having dinner and having a drink, and we talked about this really. And I think I've been at that point year after in practice, and I remember in that whole year, I didn't remember him taking a single vacation. In that whole year, I didn't remember him saying, "Hey, this is my what I do to slow down my hobby, or plan a vacation properly." And his only travels were basically just conference, go teach surgery, and just like I seek him in advice to how to develop my practice for somebody who's been doing this longer than I have. I felt like I can give in my 2 cents on that as well, right? Because that's like things I can, advise him on, and I was glad to see that it was actually helpful in coming to reality, actually.
I don't think you guys, I mean, I'm sure you realize, but having your friendship and you
Mhm.
guys both having the same profession is such a huge support system, because we have our family members who love us, but people who you have to be what we're doing to kind of fully grasp how heavy things can get. So I think, just the fact that you guys are friends and doing this too is a great
Yeah.
outlet.
But
Is
you
really
you
something special.
you know, Dee, that surgeons in general are pretty tough in terms of of having friends in the same practice that you can kind of,
I know. That's why
hey,
I said
right?
this is special.
I know, right? So it's kind of different because I've seen a lot of surgery groups implode because of egos, right? I mean, so we
Right,
all have seen
right.
that, right? But yeah, but I agree with you. So it's totally important. Mental health. Like I said, I love your motto: better mind, better life, right?
It's so
And
connected.
we've been doing that more and more. So my wife has been. One things I did. I put my wife in contact with my office manager, so I already know the days I'm going to be off for vacation. She was
So
ready to
Andre, how many
plan all that.
vacations, how many vacation days are you taking now a year? I don't
I
like
take
that.
all.
None. I don't like
No,
that.
no. I take all my 30. We have 5 weeks.
Oh, you get 30? Very good. Very good. Okay.
Yeah.
I'm happy with that. I'll leave you
Yeah.
alone.
Well, it would be nice if you do more.
Good, good, good. And I'm
Right,
happy that
that
you
is
recognize that
important.
conferences do not count as vacation.
Mm,
Well, I thought they did though, but I
they're
guess
not.
not.
They're
No,
not
they
complete
don't. No, they don't. Not if
disconnection,
you're
really,
speaking
and
at them.
that's what you
No,
really
no,
need to
no.
do. Just completely disconnect. No emails, no nothing. Correct. Right. Right.
Right. Completely disconnect. You're still thinking
That's true.
medicine at conferences.
I know, I
Hmm.
know. But it's good.
Now that you can have
Right.
perks, they can be in pretty places and be a nice little getaway, but it's still medicine. So we want
It's still
things where you can
working. You're still
completely
working. You
disconnect.
don't want to work.
You're
You
still
don't want to
working. You're
work
still
when you, yeah.
networking. Even if you're not presenting,
Right.
you're still networking. You're still doing stuff.
Yeah,
So,
100%.
mhm.
So the what? Sorry, I'm
Mm-hmm.
calling you D. I mean, that's how we
Oh, I
call
don't
each
mind it. I
other.
love it.
Yeah,
That's what
yeah,
everybody calls me.
yeah. So for future patients, right?
Mhm.
I it's very interesting. There are some patients that come to us. They're self-pay patients, right? They're like, doctor, do I need to do psych eval, nutrition eval, and so forth? So
Yes.
I tell them, I said, listen, buddy, you have to do all of it. The most
Mm-hmm.
important one, to be honest with you, is the psych eval, and I'll tell you why.
Yep.
The reason is, you have no idea what's going to happen with you afterwards, right? Because you might be using food as a therapy versus a comfort zone, right?
Mhm.
That what are you going to do afterwards? So you're going to need the same way you need me to give you the tool. You're going to need someone else to give you the mental tool, the mental health tool, right?
Yeah. It's the same thing. It's the same thing. It's a transition. And, and I remember when I was in residency at Emory and we were doing consults, one of our consults would be to go on the transplant side and do the psych evals before people got transplants. It's the same thing, right? It's like, you have to make sure that you're
Absolutely.
going to be ready for the
Right.
transition because it is a transition.
Yeah. So
Mhm.
it's funny. I see the psychological. Maybe I'm stretching a little bit, but
Uh-huh.
I see the what our patient might go mentally with that body dysmorphia component, right?
Yes.
That some patients might
Right.
have it. People that don't know
Mhm.
body dysmorphia, they just don't they don't understand the change. They don't like the change. They see, they look at the mirror, they see them still being overweight, even though they have a
Yep.
BMI of 25, right? So
We need to treat that.
it's very tricky, and then you need help. So how do you deal with body dysmorphia with those
Body
patients?
dysmorphia is a big one. Especially because I work in an eating disorder residential right now, where patients
Mm-hmm.
stay about 8 to 10 weeks there as we watch them as we're treating many of the eating disorders. But body dysmorphia is something we commonly see. Um, really just kind of getting to the root of it. The key to body dysmorphia is really helping the patient develop insight and developing insight that what they're seeing is a distorted image and not reality. So I think helping them connect the two, that realizing that this is more a distorted body image as a symptom rather than it being fact, is what we spend the initial time doing with them. And then also if there's coexisting anxiety or depression, which there
Mm-hmm.
often is, body dysmorphia doesn't normally just come by itself. We treat
Perfect.
that, and by
Very
treating
nice.
that, it gives them
I'm
even
going
more
to ask you
clarity.
something different that does not
Mhm.
always come hand in hand with obesity. And most patients who have obesity do not necessarily have that. But do people who have eating disorders, in your expertise, need to be basically, does that exclude them from having bariatric surgery? And how do you deal? Mm-hmm.
Ooh, that's an excellent question. I don't think it necessarily excludes them because, of course,
Mm-hmm.
binge eating disorder just got into our DSM, our most recent DSM. So we're seeing that, and people who have binge eating disorder, they may, be candidates for that. I don't
Mm-hmm.
think it necessarily disqualifies them because I don't like to make things black or white, but I do think that they definitely need to have some pretty intense psychiatric evaluation prior to making the decision because what happens is that sometimes if they already have a distorted body image, even with their BMIs going down to a healthy range, they
Mm-hmm.
still will see that prior body image that they had. So I don't think it discounts them because I do think, and I've seen it where people have made so much progress in their eating disorder. And even though they've had it when they were younger, they're able to do it now. But I just think, I would make sure that there's some
Right,
pretty
perfect.
solid
Which is
psych
really,
clearance
very
before
well aligned with
they
what
do it.
we see, and it's good to hear, for them to hear it from somebody who's such an expert like yourself. To basically show them that this doesn't really preclude you from having the surgery, but rather it's something that needs to be addressed very well. But then we can still help you with this too.
Yeah. Yeah, I don't like to make
Correct.
statements like that because I feel like everybody has like a very individualized treatment plan and it depends on their progress and the diagnosis and all of that. But especially with binge eating disorder becoming more recognized and treated, I can see how those people would become candidates for bariatric surgery. So I think there's more of a connection. I love the fact, we can't say that they're eliminated from the candidates for that.
Of course not. Of course not. I mean, we see them, right? But I think for those patients, what we like to do is that they get a couple of sessions,
Mm-hmm.
right, with their mental health psychiatrist or psychologist, wherever they're using for a long time. I just don't want it to be just clear like that. I want them to really understand, have a grasp for it, what they're doing, and then we do it. So people don't understand. If you're not cleared
You can't do it.
psychologically, you can be cleared by everybody else.
Yeah, you can have cardiac clearance, everything. If you don't have it psych,
The bariatric surgeon will not do it.
Very good.
Will not do it.
Because that'll be a world of problems. Mm-hmm.
Oh my! It'll be worse than having a heart attack.
Yeah, I'm serious. Because of the impact of what can happen. Yeah. I think that's excellent that, that is mandatory for them to do the procedure.
100%. 100%. Listen, Dee, I don't want to take your time. This has been awesome.
This has been wonderful. I love this podcast.